Okay, this week we just discussed the chapter on poverty, welfare, and health. Mostly what we're going to talk about here is welfare and health. The first question is, what are the components of welfare reform started by President Clinton in the 1990s? Well, I listed the five things here. It gave states control over welfare. In the 1990s, they got control over welfare. Not necessarily that they wanted it, but the federal government kind of turned it over to them, ending 6 decades of federal government control of the program. So that was one of the things, and that was the newest thing, that the states are now going to take care of it, and therefore it's going to vary from state to state or be different from state to state. It's not going to be a national program anymore. Number two is welfare was funded by grants, federal block grants, and then the states had to match that money. So the more richer states could pay more, just like it was back in the day before the federal government took control of all this stuff. Um, so you got a block grant, which meant you may or may not get money depending on how your program looked to the feds. Number three, work requirement was a major part of getting any aid. So this was the biggest and single most important characteristic of the welfare reform, was that people had to work. The Republicans had talked about this for a long time, but it took Clinton, a so-called liberal, to go ahead and implement a program like this. And of course, once you decided that anybody who got money from the government for public aid, and public aid had a really bad name then, especially since the days of Reagan, where he had these fictitious stories, we would call it fake news now, about welfare queens and driving Cadillacs and all this kind of nonsense that really gave poor people a bad name. They didn't have that problem back in the 30s during the Depression, but it became so later on, especially when there was a racial element to a lot of this, that the view of most Americans was that the typical person in poverty and on welfare was African American or black, and none of that stuff was true, but it really gave this whole process a bad name, and that's why somebody like Clinton could come along and make political hay out of the idea that everybody who got money was going to work, because that the contention was that they were just getting something for nothing, and they weren't trying to get out of poverty, and all the kinds of crazy things that we even hear today. So what happened to that? What happens when you require work is that the numbers are going to go way down, because a lot of people who are on welfare are unable to work. They can't work for a variety of reasons, like disabilities, old age, can't find jobs, don't have skills. The list goes on and on. Another thing, and this is pretty significant to the change in the welfare system too, was that there was a cap on it. You couldn't get welfare for a real long time. You couldn't live on it. Again, the myths were that there were generations of people on welfare, going from one generation to the next. Nobody was ever getting out of it. So now they put a cap on it, 5 years and you're done. And if you didn't live up to the requirements, you were going to get kicked out of the system. That's pretty much it, and as number five. So those are the basic components. And the one thing that sticks out from all that was that you had to work, or you weren't going to get anything. Number two is, what's Obamacare? The Obamacare essentially is a program to deal with people who don't have insurance, to get insurance for people who don't have it. At the time that Obama took office, I think, and started this program, got it passed through Congress, there was about 64, 65 million people unemployed. I mean, uh, without health insurance. So there's about 65,000 people walking around who had no health insurance. That meant that they had to go to a emergency room, or they got no health care at all, that kind of thing. So anyway, what I wrote here is that health insurance for everybody. So now the 65 million would get coverage. So in other words, they'd be able to buy health insurance. In the past, they weren't able to qualify for health insurance for a variety of reasons. Like they had a pre-existing condition, they had some illness already, or they were only working part-time, or some other reason why they couldn't get insurance. So the first was to make sure everyone could be insured. Insurance companies could exclude people with pre-existing conditions or a whole variety of other reasons too. So now the basic idea was that health insurance companies or insurance companies had to take everybody. And so it required everyone to have health insurance for at least 9 months out of the 12-month period, or be subject to a tax. So everybody was going to be able to qualify. That's the whole idea. That everybody, for whatever reason, if they had a pre-existing condition, or they're only working part-time, or whatever the condition is, whatever the situation is, I should say, they would be able to get health insurance. And it's helped people get insurance, and most of, or at least, let me say it this way, at least half of the people who were in that 65 million were able to get health insurance on the Obama system. The Republicans have hated it all along, and essentially that's in large part not because it's a radical difference in the way the system works, because it's still everybody just buys health insurance, but rather the reason is because the insurance companies don't like it. They just want to insure the people that they think are healthy, so they wanted to pay out and so that's kind of what the problem is. Number 3 is, what's the difference between Medicare and Medicaid? Well, this is a quick one we can answer pretty simply. Medicare is for the elderly. It's a system that makes sure that health insurance or health services are provided to people who are essentially retired or have reached the age of 65. Back in the day when I was younger, everybody retired when they were 65. Now a lot of people don't, for a variety of reasons. They like what they're doing, they can't afford it, whatever it is, that they don't want to retire, and you don't have mandatory retirement anymore. Like I said, when I was younger, mandatory retirement was for everybody. Didn't matter what kind of job you had. When you got to 65, you retired. But nowadays, people are working. The sad story is stuff like they got menial jobs, like working at grocery stores, bagging groceries and stuff like that, even though they're elderly and should be enjoying their what leisure time they have left. Anyway, the Medicare provides them with medical coverage, which essentially covers doctors, hospitals, and drugs. That's the basis of what Medicare covers. And it's only for the elderly. And so that's essentially how the system works. There's a few exceptions to it, but I won't go into that. And then Medicaid is a state and federal program administered by the states for the poor, which essentially does the same kind of thing. It gives health coverage to the poor. So what is poor? Poor, if you go back and you look at your poverty discussion, it's below the poverty index, where people are legally defined as poor. So if you're poor or you're elderly, you get medical care in the United States either under one of the two programs. Now, neither one of them are ideal, but it's better than nothing. I would say the Medicaid is worse than the Medicare, but that's a personal opinion. And the last question is, why is the medical system in the United States so expensive? That's a really good question, and a lot of people can argue other things than what I wrote down here, but here's my take on it. The first thing is that their administrative costs are very high. So in other words, to deliver medical care takes a lot of bureaucracy, especially when you're talking about government involvement, but even private systems are very bureaucratic. There's all of this stuff that you have to fill out, and forms and HIPAA and all this kind of stuff that goes on if when you go to a private doctor. If you go to a doctor in our traditional medical system, you'll know what I'm talking about. I mean, before you can even see the doctor, they got you signing a whole bunch of forms, and then somebody has to process all those forms. Anyway, to make a long story short, it is very costly to have administrators, people who are working in the system, whether you're in a medical system, as a private, private medical system, or you're in a public medical system. That bureaucracy is big. Even, I go to a doctor who's in the Presbyterian, it's called the Presbyterian Group here in New Mexico. And that's a huge office with a lot of administrators. The doctor has her own administrators, and then there's the general administrators that, apply to everybody who walks in the door. So it's very high maintenance kind of thing. Second thing is drug costs. Cost of drugs in the United States are crazy. Excuse me. Drug costs can range from hundreds of dollars. It's not uncommon to see a little bottle of pills costing hundreds of dollars. If you go to like a dermatology, you go into dermatologist, those drugs there are very, very expensive. You buy some kind of cream that you put on your skin for some reason or another, and it's not uncommon for it to be several $100s for a small tube of cream. So anyway, those two things, and they seem to be going up all the time. The administrative costs and the cost of drugs are going up all the time. It's pretty outrageous. And what that means, the drug companies are demanding more money, and that means that the people who even have insurance, the people who don't have insurance, forget about it. They're not even going to get these drugs. But the people who do have insurance, they're going to have to pay more to get the drug. So it's not uncommon for your co-payment to be $30 or $40 if the drug is hundreds of dollars. The third thing, and this is doctors. This is the way doctors practice medicine in the United States. They're practicing defensive medicine. Now, you can blame this on lawyers, because we have all these millions of lawyers in the United States, and they're more or less, in my view, corrupting everything. You can't read a contract. You can't even watch a movie on your screen at home without seeing these political disclaimers and political information, that legalese about don't steal this stuff, it's a felony, and so on and so forth. Anyway, it's everywhere. You can't read things anymore. It's not common. To read a contract, you have to go get a lawyer, all of that kind of thing. And where it's permeated medicine is that the doctors have been sued, and the fear of being sued by lawyers who are claiming malpractice, those things have led to what's called defensive medicine. So now doctors are practicing defensive medicine. And what that means is doctors are afraid they're going to get sued, as I wrote here. Doctors are afraid they're going to get sued, So they order multiple tests, even when they're certain they know that what the diagnosis is. It's incredible that doctors will know that you're not really sick. That at least they make that prognosis, but they have to back themselves up. At least that's how they see it. So they'll send you for a battery test, which may cost thousands of dollars. I remember one time when I was still living in Illinois, give you an example of this kind of stuff. When I was living in Illinois, I I was having this pain in my side, and I didn't know what it was. And I was having this pain, and it would come on every once in a while. It was pretty severe, but then it would go away. So I go to the doctor, and I told the doctor about it, and he said, "Well, I'm going to send you for an MRI on your hip." So what happens is I go in there, and they couldn't read the doctor's prescription for the MRI or whatever, but they wanted to do a full body scan, which would cost several $1,000s, maybe $30,000, $40,000. Well, I wouldn't let them do it. I just said, I'm in here for my hip. You take my hip. It's my right hip. You take my right hip, and that's it. I'm going home. But this is the kind of thing that happens. Nobody seems to care. They just say, well, my insurance will pay for it or whatever. Yeah, go for it. And it's just ridiculous. Or they'll give medicines. In part, that's partially the problem of the consumer, who will feel like I'm not getting satisfied unless I get some kind of medication out of the doctor. Anyway, that's just the whole problem of this whole defensive thing. You've got to make people feel happy, otherwise they're going to try to sue you. Number 4 is an expensive mix of treatments. Way more intervention than we need. We begin to do things like, what happens in medicine is that they begin to do things that are really radical forms of intervention, and they pan it off as ordinary, like bypasses. I think there's a bypass done every 7 minutes in the United States. So those are some of the examples I used here. Bypass, stents, where they stick that stent in there. All the kind of stuff that, those things are, the kind of stuff is, to deal with clogging of your arteries. And the reason that your arteries are clogged is because you're eating all the wrong foods, all kinds of saturated fat, and that's the problem. So they have to figure out a way to keep you from getting a heart attack. So they do a bypass, they do these stents they stick in there. And it seems to be seen as normal, because they do so many of them. And now it's all about replacement parts. And you get to my age, they're talking about, getting a knee replacement or a hip replacement or all these other things. And I'm sure there are some people who need that stuff. And they, in part they need it because of problems that have taken place. Part has been their diet and stuff. But a lot of it has to do with, the fact that we just get an older population. But the idea to think of these things, like, oh, I'm going to get a hip replacement, or I'm going to get a knee replacement, like it's some ordinary activity, is crazy. It's crazy. And then drugs, we overprescribe drugs all the time. No, the biggest problem here, as I see it, is that there's no interest in prevention. And I don't mean tests as prevention. That's what medical system talks about when they talk about prevention. Just look at some ads for that kind of stuff. It's get tested early. Go get a mammogram if you're a woman, or a colonoscopy, or something like that, in order to prevent yourself from early detection. Basically, that's what it is. It's early detection of cancer or some other problem, and then we can cut it out of you or do what we have to do. Anyway, those things are all overprescribed and crazy, because real prevention doesn't have anything to do with that. Real prevention has to do with diet and exercise and all of that kind of thing, not this nonsense of testing, because oftentimes these tests are more dangerous than their actual benefit. And then drugs, we just pass out drugs like crazy. I remember when Viagra first came out, I went to my doctor. I go to the doctor for checkups. I have a hereditary condition of high blood pressure, and I've had it since I was 24 years old. And so I have to go to a doctor and make sure that that's under control by taking some pills. I mean, I certainly do all the other things, but it's still, since it's hereditary, it really maintains itself regardless of what I do, essentially. But anyway, I go in there and I see a doctor about once every 6 months, take blood tests to make sure the drugs aren't affecting my kidneys or liver or something like that. Anyway, Viagra had just come out. So what does the doctor do? He asked me, do I want Viagra? I didn't ask for it. I didn't tell him I had erectile dysfunction or anything like that. He just asked me if I want some. And he had these stories about how young guys were taking it and they could keep an erection for hours. I never thought that was a good thing. But anyway, doctors just, at least the doctors I've gone to, have been pretty cavalier about passing out drugs. They get a lot of samples. That's a whole nother thing. They're visited by representatives of drug companies. They get a whole lot of samples and they pass them out to their patients. That's what this guy was doing. He had a whole bunch of Viagra and he was trying to just get rid of it. But anyway, they shouldn't take that kind of approach. As a matter of fact, anybody who has erectile dysfunction or something like that, there could be a sign, not just that they can't have sex, but that there's something very seriously wrong with them. Maybe they've got heart condition, clogged arteries, that kind of stuff is very much a possibility. And they shouldn't just be treating this like it's some kind of a game about how much sex you can have. Another thing, number 5, is specialization. First of all, there's a lot of specialists in medicine in the United States. There's very few, the general practitioner types. Everybody's a specialist, or pretty much everybody's a specialist. And specialists command a lot of money. That's the basic bottom line. Here's what I said. Specialists are commanding high reimbursements. They want a lot of money. Overutilization of specialists through the current process of referral decision-making drives healthcare costs up. For example, my doctor that I have here in Santa Fe, she's always pushing some kind of specialist. One of the problems that people have here, because the environment is so natural, is that people get a lot of allergies to pinyon and other kinds of things that bother your nose. So you'll get allergies or allergic reactions to a lot of the plants around here. And so, she'll be asking you, do you want to go to a specialist for problems like that? And I always told her, no, I don't need that stuff. But anyway, they're always pushing it, whether it's dermatology or whatever. The general practitioners or the internal medicine people that I go to, they're always trying to get you to go to some other specialist, and that just ups the price. A lot of times it's stuff you don't need. My next door neighbor has a terrible story to tell about allergies, where he took shots for 12 years and he still got the allergies as bad as they ever were. And then the last one is that there's no control on cost, which essentially means that there's no price for anything. That's essentially what I was trying to say here. There's no price for anything. Even if somebody, you're in a hospital and they give you an aspirin or something, there's no telling what they could charge for that. It isn't saying, well, you can get an aspirin for, say, 50 cents in the store, and therefore we should charge 60 cents because we had somebody give it to you. And no, instead of all that, what they'll do is they'll charge whatever they want. And that goes whatever the traffic will allow. In other words, if they're in a rich area and the patients are rich, they'll charge more money. It's you see that most often with something specialties like plastic surgery. There's so many plastic surgeons. There are one on every block in places in Los Angeles where people are rich. You know, Beverly Hills, that kind of stuff. And it isn't just because they all work in the movies. It's because they can afford plastic surgery and the surgeons can charge whatever they want. One of the biggest problems we have with the medical system in the United States is that if you go to small towns and small states like New Mexico, you have a shortage of doctors where everybody wants a practice in big cities and where the rich people live, and that's all so they can make more money. Anyway, those are some of the reasons why we're in this situation.